Hi everybody, this is Shelly again. We're going to start on chapter 11, the lymphatic system disorders. This module is not a really big chapter load, but it will be important later because you need to understand how the lymphatic system works, because it does play a pivotal role in the body. Now, I want you to make sure that you look over the structures and functions of it, okay? You need to understand what makes up the lymphatic system and what the functions are. The biggest function is the return of excess interstitial fluid to the cardiovascular system. This plays a big role in edema, okay? And those vessels empty into the subclavian veins. They also play a big part in filtering and destroying foreign material, and they initiate that immune response. They also absorb lipids from the GI tract. So this is all very important. Understand how the vessels work, okay? I'm not going to go over this with you, but I want you to really kind of get into the chapter, into that part of the chapter. And that is with the lymphatic circulation. It starts on page 215. This will help you later on when you're in the nursing program and we are talking about edema and how infection happens. Know that lymph is clear, watery. It's an isotonic solution, so it's not hydrostatic or osmotic. It just kind of is there, okay? It circulates with the system. It does resemble the blood plasma, but it has a lower protein count. Here's some more, and I just kind of say it a couple different ways so you can understand what we got going. That there's blind ending capillaries in the tissues, and then they go into larger vessels. The lymphatic vessels are interrupted periodically by lymph nodes. We've all had that sore throat. We've had the little lumps under our arms, that kind of stuff, okay? Know where your lymphatic nodes are. If you haven't had a health assessment, you will eventually, okay? So this is a good time to get started being familiar with where the primary lymphatic nodes are. Lymphatic disorders, there's not many, but your biggest ones are going to be your lymphomas. You're going to have malignant neoplasms that involve the lymphocyte proliferation in the nodes. The etiology is usually unknown, and the big ones you have to know the difference between Hodgkin's lymphoma and non-Hodgkin's lymphoma. That is going to be, there's going to be test questions not only on the quiz, but there will be some questions on the midterm and the final where you have to decide which one is which. Hodgkin's lymphoma is usually going to be a single lymph node chain, okay? It's a cancer, and it originates in the lymphatics, and it goes to the organs. You have T lymphocytes seem to be defective and the lymphocyte count is decreased. So these people actually have a decreased WBC count. The big thing is the presence of the Reed-Sternberg cell on biopsy. All right. Then we have staging is done by the Ann Arbor staging, and the prognosis is dependent on how many nodes are involved and the location of the nodes. Obviously, the more you have, the worse it is. But it usually Hodgkin's lymphoma will follow one side of the body. Here's a picture of the Reed-Sternberg cell, just so you can look at it. I like my pictures. Know the signs and symptoms. The first indicator is usually going to be a painless enlarged lymph node. Later, you're going to have splenomegaly and enlarged lymph nodes. And you're going to have those general signs of cancer. Non-Hodgkin's lymphoma is actually going up. They're actually seeing an increase with HIV patients. And it is similar to Hodgkin's lymphoma, except that the tumors are everywhere. They're usually not just on one side, but these make it more difficult to treat because they really can't find them all. Same thing is going to be with these. It's going to be enlarged painless lymph nodes. Now I have this video for you and I want you to watch it. I think it's a very good video and it explains non-Hodgkin's very well. Then you have multiple myelomas. These are neoplastic disease that involves the production of plasma cells in the bone marrow. The etiology is unknown. It is really a slow, insidious kind of disease, and it has a poor prognosis because by the time that they find it, it usually has already done a lot of damage. Here you have multiple myelomas, and they're actually in the brain. Yeah, I'll get my little thing out. You can see them right along here. See, these are all the myelomas. All those little bubbles right there. Okay, we have some more here. Alright, so that's what that looks like. Know the signs and symptoms. It's always going to be insidious, okay? Usually they have pain because it has bone pain. They're going to have impaired kidney function, and eventually they're going to have failure. The median survival rate is 3 years. Lymphedema, that's an obstruction of any of the lymphatic vessels. Sometimes it is congenital. It says most time in the book. I haven't really seen that much congenital lymphedema. Treatment is always going to be diuretics, bed rest, massage of the affected area, and an elevated affected extremity. Now these are extreme cases of lymphedema. The one woman that you see with the arm, she has actually had a mastectomy, and because they took away the lymph nodes, we have an obstruction of those lymphatic vessels, and we have a collection of fluid. Same thing on the leg. These are often women ages 15 to 25 because you do have all those lymph nodes around the breast tissue. As the swelling progresses, the edema becomes hard and unresponsive to treatment, and they have frequent infections. Usually they're going to be some kind of cellulitis because it does get so big. Elephantitis, it is very rare to ever see this here because it is a parasite. Alright, so that's really what it's all about. I've got a good picture on the next one, I think. Yeah, that's a great picture of elephantitis, and it's actually the parasites that are blocking the lymphatic ducts. Castleman disease is another rare one. You might see one on the quiz. I can promise you, if you see it on the quiz, you're not going to see it on the midterm because it is so rare. Study questions. Think about the description and function of the lymph nodes and the thymus, tonsils, and spleen. Compare and contrast Hodgkin's and non-Hodgkin's lymphoma. Be sure that you understand the pathophysiology and the signs and symptoms. Know which one is different than the other. Now, I know this is a very short chapter, but later on it will play a big part when we are dealing with stuff in a clinical setting. Okay? Let me know if you have any questions. Good luck, and I'll talk to you later.